Hello and welcome to South First. I am Chetina Belgire. Well, much attention is being given to cancers like breast, cervical, and lung. Thyroid cancer often gets under discussed. It's the 12th most common cancer globally, affecting women in particular more than three times more than men. And it is commonly being seen in younger age groups. January being the Thyroid Awareness Month, we're joined by Dr. Narayana Subramaniam, renowned head and neck oncologist and director of clinical innovation at Sparsh Hospitals in Bengaluru, to speak more about thyroid cancer. Welcome, sir.
Thank you. Thanks very much for having me.
Thank you. So could you briefly explain what thyroid cancer actually is? It is very rare that, thyroid cancer actually gets discussed, and how it commonly presents itself, especially in women.
Sure. So the thyroid gland, I think, is something most of us have heard of. It's responsible for every possible system controlling and regulating that. So it's in the front of our neck. Usually these cancers are quite common, and there are four different types. The most common are called differentiated thyroid cancers that present more in women than in men. So generally the symptoms that we can have is we can have a lump in the front of our throat, which moves when we swallow. Sometimes we can have the lymph nodes or the glands involved. Or when there's a large swelling, sometimes you can have a change in voice or you can have difficulty swallowing because of the pressure of the thyroid gland on the surrounding structures, which are the windpipe and the food pipe.
Okay. So, see, when you say thyroid cancer, the first thing it comes to my mind at least is, so if you have thyroid, does it increase the risk of getting cancer? So what are some of the risk factors for thyroid cancer, and are there any effective ways to prevent it?
So thyroid cancers, depending on what kind of cancer there are a few risks. So if you do have pre-existing thyroid disease, if you have what's called a goiter, right, which is a generalized enlargement of the thyroid gland, that does predispose you to a certain kind of thyroid cancer. If you have gotten radiotherapy to the front of the neck, that's another risk factor. Some of them run in families. It's not very common, but you could have a familial risk. So if you do have a history of family cancer, family history of thyroid cancer, that's another thing you should get checked out. But most of them are what we call sporadic, which means that we may not have a specific reason associated with them, and there's no genetic link, which means they happen because of some abnormality in the repair of our cells. There's a normal balance between cell damage and cell repair. Because of an abnormality in that cycle, we develop cancers. But these are easier to treat, and when we treat them appropriately, patients do very well.
Oh, that's nice. So is there any particular age group that actually, that this particular age group is getting diagnosed more, or anything of that sort, which exists in detecting thyroid cancer?
So thyroid cancer, interestingly, can occur at pretty much any age group, right? So you have the two ends of the spectrum. The very elderly patients can have the more aggressive versions of thyroid cancer. The young patients, even children, can develop thyroid cancers.
Oh.
So the ones that appear later in life are usually the more aggressive ones. The ones that appear early generally have a very good response to treatment. And somewhere in the middle is another group of thyroid cancers called medullary thyroid cancer. So those are the slightly rare ones. Those are the ones that need a slightly different kind of treatment. Most of the treatment revolves around surgery. So surgical removal of all the cancer from the body with sometimes additional treatment like radio ID. So the treatment philosophy is very simple. We have to treat the patient completely, eradicate all the cancer wherever possible. You may need some additional treatment as well. But the important thing to remember is that like with any cancer, the initial treatment is the most important. So if you treat the patient upfront completely, they go on to do very well. This is the one cancer that we talk about 20-year survival. So if you talk about any of the other cancers, we talk about 5-year survival and we say these are the percentage of patients who are alive at 5 years. This is the one cancer where we talk about 20-year survival. And even in the age group that's younger than 55 years, with certain types of thyroid cancer, that's 100% survival at 20 years. So it's important to treat it well. We can't take it lightly because even though patients survive, if we end up treating them improperly, they create problems with swallowing, with speech, and all of those other issues. And the amount of treatment we need is a lot more if we don't treat them right the first way around. Important thing is don't panic, get it evaluated and treat it in the right way.
So you did speak about the symptoms, but then when you're saying that children could also have thyroid cancer. So are there any specific symptoms to notice or something which you think that we should not ignore? When you talk about thyroid cancer, is there anything which is specific which we can't ignore and should be checked? Like one you said is the risk which runs in the family, but otherwise.
Absolutely. So I think as a person who deals with head and neck cancer, the one thing, well, one problem that we have is that awareness around these cancers is quite low, right? So if you talk about a breast cancer, for example, a woman with a breast lump will initially think of cancer straight away, right? If you have a lump in your abdomen, you will think of some kind of cancer, stomach flavor or
Absolutely.
something. But here, because the anatomy is very complex, people don't understand the anatomy, they're not aware. We tend to neglect problems of the head and neck quite a bit, right? So we have a difficulty swallowing for weeks, weeks become months, months become years, and then only when we cannot ignore it, we go to the doctor. So the rule of thumb is very simple. If you have any abnormal symptoms, any funny feeling, if it's a difficulty swallowing, if it's a change in voice, if it's a lump somewhere in your throat that you can feel that's not going away in 2 or 3 weeks, get it checked out. Chances are it may not be a cancer, nothing to be worried about, could be an infection, could be 100 other things. But it's very important to rule out a cancer and then get appropriate treatment. So we have to be aware that this is a problem that could be affecting us. We also have this misconception that these kind of head and neck cancers are associated with tobacco or alcohol. I've never touched tobacco or alcohol. How could I possibly get a head and neck cancer? Again, not true. These kind of cancers, specifically thyroid cancers, don't have any specific risk factors. So there's nothing that you did that could predispose you to them. So
Mm.
anything abnormal. So the best judge of all that is ourselves. So you swallow so many times every day, you speak so many times every day. Anything that seems abnormal to you, a lump that doesn't go away, any discomfort, just get it checked out. Simple process, not very painful, not very complex. Once you know it's not a cancer, very simple. Then you can go on to the rest of your life.
Okay. So for somebody who's curious, if why is it that women have the incidence in women is more in this thyroid cancer than men?
So there are a couple of theories. I think the best working theory is that the thyroid gland by nature undergoes a lot more process of transformation in women, right? And the reason for that is the thyroid gland produces a hormone called thyroxine, which regulates pretty much every system in the human body, right? So our muscle movement and neurotransmission, our neurological function, right? Like our cognition, cardiovascular system, everything functions adequately because of thyroxine. Women, because of the changes that happen in their body, primarily because of puberty, because of pregnancy, because of childbirth, the amount of thyroxine required by the body goes up and down. So as a result, the thyroid gland has to change. So just like when you exercise more, your muscles get larger, they hypertrophy. Similarly, the thyroid gland has a lot of evolution, and sometimes what happens is during that process of evolution, there's a disorder in that process where tissue gets damaged and repaired. And when there's the disconnect between that process, sometimes you can have cancer cells that proliferate and become a cancer. So all of us have that propensity, but our own bodies and our immune systems kill off the cancer cells at regular intervals. But if for whatever reason it has immune escape, so those cancerous cells for whatever reason escape that process of regulation, then they become a tumor.
Okay. So what are some unique challenges that women face when dealing with thyroid cancer, and how does it actually impact their overall health?
So I think in general, what we see, unfortunately, when we have women with uh, cancer, is that very often they neglect their own health. Uh, the priorities of the family sometimes are a bit lower for women. So the health seeking pattern is a little bit different. Women often put off getting medical evaluation and getting treated quite a bit. They wait till it's quite a big problem. And the result of that is multifold, right? So one thing is that the amount of treatment required to cure them is more, and the treatment related morbidity. So unfortunately, all of our treatments do have some side effects. So the more treatment we have to give you, the more side effects there are. So that is one aspect of it. Also, there are some traditional mindsets where sometimes there's a lot more concern about costs incurred with cancer treatment. So there's a little bit of hesitation spending that with female members of the family. It is getting better now, but it does persist, unfortunately. So I think now it's good that people like you are shining light on this and realizing that women with cancer have unique struggles and challenges that need to be addressed. So the key is always awareness, and the key is always the stitch in time saves nine. We cannot do away with having to treat this problem. We can't ignore it away. It just gets worse over time. So it's always better to get evaluated and get treatment done and dusted.
So, any latest advancements in particularly in this thyroid cancer treatments?
So one thing that I like talking about is anaplastic thyroid cancer. So thyroid cancer basically is quite unique because you have two ends of the spectrum. So the differentiated thyroid cancer that I spoke to you about has excellent survival, 99% survival at 20 years. On the other end is the type of thyroid cancer that you get in the elderly called anaplastic thyroid cancer. And this is the most aggressive cancer in human beings, right? So the thyroid is a special organ because you get this spectrum of disease in the same gland. So anaplastic thyroid cancer, unfortunately, used to mean a death sentence. So less than 20% of people were alive at the end of 1 year. But there's been a tremendous amount of work that's been published in the last few years, and we are seeing the impact of that. So the approach has changed. Sometimes we use chemotherapy and immunotherapy before we operate. We shrink the tumor, we operate these tumors. Patients, some of them go on to be cured. So I think anaplastic thyroid cancer is an excellent example of a cancer that we weren't able to treat very well 5 years, 10 years ago, but we are able to give a lot of patients hope, and we are able to have good results as long as we treat patients aggressively and we treat people as a team. So it's not only us, the surgeons, we involve the medical oncologists, we involve the radiation oncologists, the nuclear medicine. So as a team, when we come together to treat these patients, it's a lot more hopeful. And these advances we are seeing, in the last 5 years have been phenomenal.
Oh, that's nice. So you are a head and neck oncologist. So if you could, we intend to do more interviews on specific cancers, head and, because it's a vast thing now. I mean, there are specific things.
Correct.
But if you look at
Absolutely.
head and neck cancers that are affecting women mostly, if you could just briefly touch upon some of them so that we could do it in our next segment.
Sure. So thyroid cancers are probably the thyroid cancers and perhaps salivary gland cancers, right? So salivary gland cancers, we have major and minor salivary glands. So the parotid gland, the sublingual gland, which means the gland under the tongue, and the submandibular gland, which are under the jawbone. These are the three large salivary glands, and then we have thousands of small salivary glands inside the mouth, in the throat, and things like that. So probably thyroid cancers and salivary gland cancers are the cancers where you have a slightly higher incidence. In thyroid cancer, there are more women than men who develop it. In salivary gland cancer, it's almost equal. But all of the other cancers, it's men that are primarily involved. I think probably what we need to focus on is the fact that these cancers are not necessarily gender specific. But what we need to realize is that the way we treat them has to be a lot more tailor-made, right? A big issue that we have as oncologists also is tobacco use, which is rampant in women as well. So what the Global Adult Tobacco Survey in India showed that 1 in 3 men and 1 in 3 women, both in an urban and a rural setup, use tobacco, which is a huge problem. Tobacco and alcohol are huge problems that we have to deal with. I think when it comes to women, there is concern about cosmesis and function and other things. If you're talking about oral cancer, putting an incision on the face, for example, many patients are reluctant to seek treatment because they're worried that our treatment is disfiguring, right? That if you have a cancer of the mouth, that you remove it, the patient's going to be disfigured for life. They can never eat in public, they can't socialize. But I think that's very much a thing of the past, right? We have sophisticated treatments. We have very good reconstructive surgery. We can give you a new jawbone, new teeth. So I think you hit the nail on the head. Head and neck cancer is maybe 30 to 40% of all new cancers, but very, very poorly understood. Even amongst the medical fraternity, the understanding is still limited for multiple reasons. But I think the message that we have to get out there is that it forms a big part of the new cancer burden. We all have to be aware of it, whether it affects us or somebody close to us, and we have to get detected early and treated well. when we do that, these cancers have very good survivals. That is one thing also that I'd like to put on record. We tend to think that once we get cancer, it's a death sentence. What is the point of treatment? Whatever you do in terms of treatment, the disease comes back. Very much not true.
Thank you very much, doctor, for your time. And we definitely intend to speak more on head and neck cancers. And I think it was wonderful having you on the show. Thank you very much, sir.
Thank you. Thanks very much. Look forward to more chats.
Thank you, sir.